So now we know what is a community pharmacy. A pharmacy operates and serves in the neighborhood of a community. Simply in commonly used terminology, we call this community pharmacy as a retail pharmacy available in our neighborhood. So pharmacist working in the community pharmacy is called community pharmacist. The pharmacist who is working in the community pharmacy is called community pharmacist. But it is not that anybody can work. Even if one has a qualification of pharmacy, he or she cannot work in a community pharmacist as pharmacist. He requires registration in State Pharmacy Council, and what we call them as one must be a registered pharmacist to become a community pharmacist. So now community pharmacies and community pharmacy, they are all interlinked. Pharmacy does not operate like other stores. Though it is a retail store for medicine, it does not operate like other store. Pharmacy requires a license, and the license is normally given in the state by the state drug controller. Now we will see what are the various types of community pharmacies. Basically, we have three types of community pharmacists. Basically, we have three types of community pharmacy in our country. One is independent community pharmacy, the second one is chain pharmacy, and third one is hospital-based pharmacy. Yes, in addition to this, we have a new type of pharmacy that being operated in some parts of this country is called electronic pharmacy or e-pharmacy. But unfortunately, this is illegal at this point of time, but still operation continues. That is why the government of India at this moment is planning to make regulation so that e-pharmacy can also be controlled. Now let us see what are independent pharmacies. Independent pharmacy means an individual owning the pharmacy, and this person who owns the pharmacy be a proprietor, need not be a pharmacist, who employs a pharmacist in order to satisfy the legal requirement and serve the function of pharmacy. Sometimes the pharmacist himself or herself owns a pharmacy. This is called owner pharmacist program, owner pharmacist scheme. So in independent pharmacy, we have two categories. The first type, what a proprietor is a different person and pharmacist working in the pharmacy is different person. The second type of independent pharmacy, the pharmacy is owned by pharmacist and pharmacist himself or herself is working in the pharmacy serving the people in the community. So we have two types of pharmacy. Then we have second category of pharmacy are chain pharmacies. There are a group of industrial houses, corporate houses who have started several chain pharmacies, and two prominents that I am going to tell you, they are MedPlus and Apollo. Then we have third type that is called hospital-based community pharmacy. Hospital-based community pharmacy. In the hospital-based community pharmacy, what happens is either the hospital itself or some society they form, and this society operates the community pharmacy in the hospital. And why this society operates or why the hospital permits a community pharmacy in the hospital premises? The reason is most of the time the pre-medicines that are available in the hospitals are not adequate for the healthcare programs, for the treatment of the patients, and we need sometimes more medicines, and in such cases, instead of the people going outside and buy medicine, the hospital itself permits, hospital itself operates this community pharmacy where individuals can buy these medicines.